I know the physicians make a lot of decisions about your care, but it's really nursing that delivers the care to the patients. And so one of the things that was important to Southern Illinois healthcare is that we have consistent, high-quality care with our nursing staff and with the processes they were going. And so we thought that having standardized, evidence-based processes was key to having consistent quality, consistent results, consistent good outcomes with patients. There's a couple lessons that I think are very important. One, if you're not consistent with your processes and don't do things the same way, you can't expect to get consistent quality results. And so having things done differently, and it's done this way in this floor and this way at that floor, you're going to get inconsistency in your outcomes. And so that's one lesson learned. Another lesson learned is that nurses are very, very, very busy people. We at our hospital, we did some spaghetti diagrams. We took a map of the floor, and we had staff go up on the floor and watch a nurse. And they put their pencil on the paper, and everywhere that nurse went, we started to trace it. And we realized that nursing has so many interruptions, so many different things that they have to do and different processes that they have to do, that anything we could do to help make it easier for them, to help them not only do a good job, but feel confident and know that they are doing a good job, was very beneficial. Because they get to the end of the day, and many nurses in this country are burnt out and frazzled at the end of the day. And so we need to give them tools to help them deliver quality care and help them to know that they're doing a good job. Well, obviously we have meaningful use and ICD-10 and all that, but this year with this implementation of our nursing care plans, our biggest challenge for us is to gain efficiency and effectiveness in our nursing programs. And so this is a big year for helping us do our nursing improvements. We're spending a lot of time doing nurse training. One of the things is if you're going to give them a tool like a high quality EHR, you got to make sure they understand it and know how to use it. With the Elsevier care plans, it helps us have consistent care plans that are customized for each patient based upon the physician orders, but at the same time, there's consistency in what the nurse is delivering to that patient and the care that they're providing. Accountable care is all about accountable outcomes and knowing that we're doing a good job with our patients, knowing that we're using evidence-based. And it's not just nursing, it's respiratory therapists, there's a variety of clinical people involved. And so making sure that the team is doing a good job with their patients helps us get good quality when they're in the inpatient setting. And certainly we're also looking at other processes for when the patient leaves the hospital. We're trying to do some patient engagement and a variety of things for a more holistic perspective of what's going on with the patient. Another thing that we happen to be doing at Southern Illinois Healthcare is we've created a clinically integrated PHO, so a physician-hospital organization. And so we're looking at not only what happens in the hospital, what happens in the practice. So taking a holistic look at the patient is really the fundamental goal of ACOs, and that's what we're doing.